Welcome back to Iowa Live. Lou and Michelle here. We love when we bring creatures
Sue likes
on the
the
program.
camera. I'm taking pictures of her. It's like she stops.
You heard of a boy named Sue? How about a little dog named Sue? That's who this is right here. We have Dr. Shauna Green here from Iowa Veterinary Specialties joining us in studio right now.
Good morning.
And I think I found Sue's sweet tooth.
I think so. I think I'm chop liver.
Little people crackers. See, the moral of the story is always have doggy treats with you, and you always make a friend. How are you today?
I'm good. Thank you for having me here today.
We'd like to thank Iowa Veterinary Specialties for helping us out with our latest promotion that we had involving pets and photos and things like that. You had a good basket
we
that
had
was
an
available.
amazing turnout for the Halloween pictures.
That was awesome. Thank you for that. So we are looking forward to doing things in the future with you. But you have a really amazing facility. And folks, if you do have a pet, and I'm totally serious about this, you should have the phone number of this place on your wall or on your door or something.
Correct.
In case of emergency, because that's what you're all about, isn't it?
We are a 24-hour specialty emergency hospital, so we are available 365 days a year, 24 hours a day. My particular role there is I see patients or pets with cancer.
Really?
Correct. Yep. And November is actually National Pet Cancer Awareness Month, which is why we're here. We want to raise awareness that pets get cancer just like people do.
Now, is cancer the leading cause of losing pets?
For older patients, it is.
Yes.
Basically 1 out of every 4 dogs over the age of 5 will develop cancer, and 1 out of every 5 cats over the age of 5 will develop cancer.
Really? I didn't realize it was that prominent.
And you have some new treatment options for people that they may not be aware of.
We do. So we have all of the latest and greatest treatments for pets, just like they do for people. So we offer medical management of cancer, which is things like chemotherapy or immunotherapies. We also have surgery. We have a board-certified surgeon that is available at our facility now, which is something fairly new. And then we also have radiation therapy available here in Iowa too, which is the first time it's been available is just this year. So
really, yeah, the facility is really something else. It really is. It's a human quality.
Correct.
There's absolutely no question about this. You would feel
I
comfortable.
think Lou wants to be a patient.
Yeah, right.
No, I do.
I get that a lot, actually. A lot of people say, I wish that I could come to you for my doctor. Correct.
No, seriously.
Correct.
That's the kind of level that we are talking about.
Absolutely. We have a lot of great state-of-the-art equipment, so we're able to see patients, and that same day we're able to do blood work and get results within 20 minutes. We're able to do x-rays and have results immediately. We're very fortunate at our facility that we have the ability to do a CT scan, and that's read out by a radiologist the very same day. And then the most newest equipment that we have is actually a machine from Lacuna Diagnostics, where we can take a sample from a pet, like a skin sample or a cell sample, and that's digitally sent to a pathologist, and we have those results in an hour.
No way.
Correct.
So it's like a biopsy type sample?
Yep.
Really?
Yeah.
I didn't realize that's how new is that?
We've only had that at our hospital for about a month now, and it's been groundbreaking, especially.
What kind of things can you diagnose with things like that?
Yeah, so we can take a sample from a lump on a pet or a lymph node.
That seems to be really common.
Exactly. Lumps and bumps are the main part of our business here. My business as an oncologist, if your pet has a lump or bump, we need to get it checked out. So what we do is we take a little needle, just like we would take a blood sample, we stick that into the lump or bump, and then we send that out. And like I said, within an hour, we would have results of that right away. So
can you talk a little bit about how these cancer treatments are on our pets and animals in comparison to
That's a great
how they
point.
are with humans?
Absolutely. Thank you for bringing that up, because our goal in veterinary medicine is I don't want to make your pet sick. I only want to make your pet feel better. So quality of life is our focus. So we are a little bit more tailored to what can we do to keep our pet active, healthy, and doing the things they love versus trying to, completely obliterate their cancer, which unfortunately can have a lot of side effects. And so our goal is to really have no side effects from our treatment, or if they are very minimal or very temporary, so that hopefully they can go back to doing whatever they love. Oh my goodness, sorry.
She likes Doug.
You can do whatever
She
you
likes
want.
Doug back
Sue,
there.
you can do whatever you
Come here,
want.
we all
I don't know
have
about
treats
that.
for you.
Have free reign. She has free reign to do what she wants. But obviously, Sue is a very happy pet. He is a very, very happy pet. Now, speaking of a boy named Sue, which is, again, a dog named Sue at the same time, is he in good health right now?
He is. So basically, Sue is still a young guy. He's going to be 2 here soon. But again, I've treated dogs, unfortunately, with tumors as young as 6 months old.
Seriously?
Yeah.
What type of dog would have the tendency to have
There's certain breeds of dogs that are more likely to get cancer. They're really all great dogs, which is why, unfortunately, it's so important for us to know that dogs dogs like golden retrievers and boxers and Great Danes are some very popular breeds that unfortunately have a very high risk of developing cancer in their
Really?
lifetime. Yeah.
Now, this is a Dalmatian.
It is a Dalmatian.
Okay.
Yep.
Is there anything in particular that you look for when dogs come in? I'm sure there's a whole array of things that are high on the list.
Correct.
For a Dalmatian, for example, like Sue.
Yeah.
What would be high on the list for you to keep an eye out for?
For me, one of the reasons I love this breed so much is actually do have a really low risk of cancer. They actually have other health issues like urinary issues, so we would want to make sure that we're watching for those kinds of things. But definitely there are certain breeds of dogs that are more prone to getting certain diseases. So like we talked about, golden retrievers, they often get tumors on their spleen or tumors of their lymphatic system or lymph nodes. Great Danes unfortunately get bone tumors. And so again, those
are the larger
particular
dogs
things.
more susceptible? It sounds like
They are,
of getting the cancers.
They are, but there are smaller breed dogs like terriers who unfortunately get bladder cancer very commonly.
Oh,
So
really?
again, it kind of depends on the dog, and that's why we kind of check them out from the tip of the nose to the tip of the tail, make sure that we're not missing anything at
But
all.
quality of life,
Correct.
that's what you're focusing on now,
Absolutely.
and that's the thing, because you don't want to just pump them full of chemicals.
It's
and
not
then-
worth putting them through the treatment if it's not going to make them feel good. Unfortunately, we don't have our pets as long as we do people, and so we want every minute with them to count and to be a good quality minute, which is why, again, we give lower doses of medications as far as cancer treatment, so that they don't have those negative effects that people sometimes experience.
Right.
Can I ask you about kind of the expense that goes along with a lot of these
absolutely.
treatments? And are you seeing a lot of people that have insurance programs? for their
Yeah,
pets?
insurance is very important. So if you are thinking of getting a pet, I would absolutely recommend getting insurance because unfortunately, just as with the world in general, things get more expensive with time. And obviously, again, we want to be able to offer our pets every single thing that we can to make sure that they live as long as possible. So we definitely are seeing more people that are investing in health insurance.
Can I ask you, what percentage of clients come in with pets that do have insurance?
Yeah, I'd say it's about 25%.
That's a lot.
It is. It's getting more
and it's
all
getting
the time.
better, isn't
all the
it?
time.
Yeah.
Correct.
Because it's more affordable.
Exactly.
Now, too.
Yep. And people are just more aware of it. For a long time, people just didn't know.
Didn't know about it either.
Yeah.
Absolutely.
And there's some
Just
major
recently.
companies that you can add it onto your policy.
Absolutely. And in general, they help to take care of the simple things, like if your dog ate some chocolate and we needed to address that,
Right.
or say that they got us, into the Christmas tree or something along those lines, we can deal with that. But especially for more expensive things like cancer treatment, which unfortunately can be cost prohibitive for some people.
Right.
They love
And you have to make that decision.
They have to make those tough decisions. And, that's where, again, we try and offer a variety of options, whether it's, the latest and greatest technology, but also palliative care. If we can do something just to make that pet comfortable, that's our job as well. So.
All right. Your
for
facility,
everybody.
again, is, hands down one of the greatest places in
Well,
the
thank
city
you.
of Des Moines.
We think so.
Yeah, we know so. And now, again, if you do have a pet, make sure you have their number available because it can happen anytime, day or night.
Unfortunately, yeah.
And you guys are available, right?
We are. We're here all the time.
Tell everybody where you're located.
We're at 6110 Creston Avenue over by the Valley Junction region.
Okay, there is the phone number on top of the screen there. Again, write that one down, post it somewhere, keep it handy, and if you're going on vacation and somebody's keeping an eye on your pets, make sure they know about that number too, along with your local vet you go to on a regular basis.
Absolutely.
So keep that in mind for this service at the same time. Wonderful. Well, thank you, Sue. You did a good job,
did a
buddy.
job.
Great
There,
job, buddy.
buddy.
Good job, buddy. Yeah, good job out of you.
He's
Thanks so
sweet.
much
Yeah, no
for
problem.
being
Thank
here.
you.
He
All
is
right,
sweet.
there it is. That's my buddy, Sue.